going back to this structure of the cartilage. Now, like I said, we will have a cell that will give rise to, which would be the blast. Once the blast is going to be, and this is for cartilage and bone, once the blast gets stuck in its matrix, it now becomes the site. So as it has laid down the matrix, one of the things that was present in cartilage, if you remember, they have the proteoglycans, which looks like the little test tube brush. Okay, looks like the little test tube brush in their matrix. Their matrix, like we've said, is that firm consistency. All right. They will also have that hyaluronic acid that will be present. Now, the goal of cartilage, okay? The goal of cartilage is to be, for the most part, providing the cushion between bones, okay? Think about cartilage of your knee, cartilage between the vertebra, cartilage between the pubic symphysis. It's giving cushion, okay? Now, what we will begin to learn is that structures of our body are covered in connective tissue wrappings, okay? And one of the things that is present on cartilage is what they term a perichondrium. Chondro, of course, referring to cartilage, the term peri meaning around. Okay? Does that make sense? So it will have this perichondrium around it, which is a dense, irregular connective tissue. Look what it contains. It contains fibroblasts. What did we say that means?
Which one?
Fibroblast. What does fibroblasts?
A lot of immature fibers.
Our fiber material. It is our immature cells. If cartilage is heavily based on collagen, for example, you would probably find a lot of the fibroblasts that could give rise to the cartilage. If it's cartilage like you think of at your nose, okay, which is a lot of elastic cartilage, you would think it would have a bunch of the fibroblasts for elastic fibers.
So when someone says they broke their nose, is it really is like the cartilage that they broke, right?
All right, if you think about the structure, if they truly break their nose, the bones are broke up here because the bone stops about right here. You can kind of feel the little bump in between the bone and where cartilage begins, okay? So they can get their nose knocked out of joint, which could hurt that cartilage a lot, but it might just be the separation of the cartilage to the bone, and the doctor goes in and does that, tapes it up. That's not necessarily breaking the nose. Well, I guess it could be because you technically
Dislocated.
dislocated your nose, okay? But the true bone is up here, and it would be that disconnect between that cartilage and the bone. All right, so this perichondrium will contain the cells that help give rise to my matrix, which is now firm in cartilage. How does cartilage heal?
Slowly.
Very, very, very slow, if at all. They usually don't. The reason for that, it does not have a blood supply. The dense connective tissue around it does, but cartilage doesn't. So how is it that if we think about cartilage of the body, especially something like this, the fibrocartilages, cartilages between the knee, ow, that hurt, okay? Even cartilages between the bones of the fingers, okay? How do we keep this particular type of tissue nourished?
I guess by stretching.
Stretching helps. But what? You want, which one?
You could put a steroid shot.
Yeah, no. Let's see what this. Now, here's what you got to do.
Walk. Dance.
All of it. I know that was bad, right? But that's okay. You want to know, and people, okay, you know how you get people that'll do,
Yoga.
did y'all get it popping? And on.
Therapy.
And
physical
stretching, okay? Do you happen to know what that's helping with before they get ready to do their?
Release
It
air.
loosens up their muscles and their joints.
Okay,
Release
so loosen
air.
up your muscles. Huh?
Release air in the joints.
Okay, some people might be like, release that air in the joints. You squish it. Squish, 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 squish. You're squishing the blood supply to that cartilage. We should say the tissues around it. Okay? But it gets to kind of rush over the cartilage, get rid of waste, because these cells are alive. These cells are carrying out metabolic processes. They are creating waste, okay? The more you move, the better you cleanse them, and the more fluid you push in. For these little proteoglycans to act like the little test tube brush, trap that water and trap that material so that when you move again, you're washing more over that cartilage, bringing more in. Do you see where I'm going? Because it doesn't have the blood supply, which is the reason a lot of times if people damage a disc in their back, it doesn't heal, okay? Because there's no blood supply to bring in the healing agents. So, in thinking about this structure now, because we, like I said, as we go through this chapter, we have really got to change our ideas about what a tissue or a cell is. So now we are in a tissue type, cartilage, that has the firm consistency, and it's dependent on some type of outside force to help keep it cleansed and nourished. So the types of cartilage that we're going to find in the body. we have our hyaline. Hyaline cartilage looks like pretty flowers in glass. I mean, seriously, that's what it looks like to me. Looks like pretty little flower petals.
Japanese cherry blossom.
Exactly. Looks like little cherry blossoms stuck in glass. This cartilage, it has a large amount of our collagen fibers. We have our proteoglycans that are present, the stuff that looks like a test tube brush. It helps make areas that are smooth. So if we look at where something may articulate, do you happen to know what that means? The two parts coming together, like two bones, articulating, okay? It will help to form, for example, a layer over the ends of those bones so that they move easily because of its structure. It's very smooth. We find it in the rib cage, the trachea, and the bronchi. In the developing fetus, it is what's making up the majority of the skeleton. When babies are born, babies are mostly cartilage because cartilage allows for growth that will take place in bones. I mentioned earlier that the model for bone is cartilage. So, having this type of structure allows for that infant to not only grow this way, but to grow this way. And as they grow, bone begins to take over the cartilage until you have reached the end of your growth, usually for females about 18 to 20, males about 23 to 25, and by that point, any area that the bone should be hardened bone should now be hardened bone. This glassy, clear cartilage should now be at the end of the bones for articulation. So we have our hyaline cartilage. We have very tough cartilage that forms. This one is called fibrocartilage. It is extremely tough, has lots of the collagen fibers. Once again, in the proteoglycan matrix, where it contains a lot of the stuff that looks like the test tube brushes. It's a tad bit compressible. Think about what you have between the vertebrae of your back, okay? And it's very tough. Takes a lot of wear and tear or some type of traumatic event to break that cartilage, to damage that cartilage. We find it in the areas of the body where there's a lot of pressure. For example, between the vertebra, in the knee, you've got some in your jaw, which is really cool. Huh?
So
Hyaline and what?
and fibrocartilage is coming.
Yes. When you look at the knee, for example, that structure that you have that needs to do this, okay, right along the edge of each bone is where you would find the hyaline. The